We are back with Dr. Olu Jegede, the Chief Health Equity and Community Impact Officer at Cone Health. We were just talking about the importance of knowing and keeping track of your blood sugar and some of the symptoms that can be caused by a low or a high blood sugar level. Is this something that's easily treatable, or is there a bigger concern here?
There's a bigger concern because causes a lot of complications, including kidney failure, and then you have people on dialysis, or even on ulcer that is now healing that may now lead to amputation. But you know what really concerns me the most as a doctor? 1 in 3 people here in the United States have what we call the pre-diabetes, which means their blood sugar is high beyond normal, but it's not high enough to diagnose diabetes. And what happens is, if it is not controlled, people now move from that pre-diabetes to diabetes. And unfortunately, this 1 in 3 people don't even know they have pre-diabetes. And this could be people that you know, that in your neighborhood, your closest friend, your family, even at the dinner table, is 1 in 3. So get the numbers, know your numbers, get checked out.
Is it true that, once you are put into this pre-diabetes category, that it is possible to backtrack in a good way?
Absolutely. It is easy. Well, maybe not easy, but it is possible to backtrack. And this is, like change how you eat, move more, and manage stress. Your body can actually come back from this pre-diabetes state, but you have to be conscious of it and you have to have a plan so you don't move into a full-blown diabetes.
Cone Health offers a lot of opportunities for free screenings when it comes to blood pressure, blood sugar. Can you talk about those?
Yes, we are really excited about our events. We call it Building a Better You event, which is Cone Health's community wellness series that is designed to bring essential screening, preventive care, social resources directly to the neighborhoods that we serve. And these are free, they are family friendly, and no insurance is needed. You don't need appointment, just show up. And because we know transportation and cost and time, even childcare could cause barriers to care. That is why we are bringing these resources and care to the community.
Can you expand on some of the different resources provided at these events?
Yeah, so each event, people can get free blood pressure checks, blood sugar screening, cholesterol checks, even body mass index. We check all that and making sure that we're explaining your risk factors with you. And we also have teams on site that help connect attendees with resources like food assistance and housing support and transportation options, mental health services, and also helping them find primary care provider if you don't have one. And I can quickly, share the dates that are coming up. One is on April 18 at Randolph County. We have May 16 at Alamas County, August 1st at Guilford County, and September 26th at Rockingham County.
So let's say people go to one of these events and they realize that they're identified as someone who is high risk for having something like a blood pressure or blood sugar issues. What's the process from that point?
Yeah, that's a great, thank you for asking. So we ensure that nobody leaves without a full next step. If a screening shows elevated blood pressure, blood sugar, or other concerns, our clinical teams are on site to provide immediate guidance. So if someone doesn't already have a primary care provider, for example, we get them one with an appointment before they leave. We connect them to the community-based organizations with resources, all the social needs and the medical needs with referrals and follow-up. So we make sure that our people are not navigating this very complex system alone.
When it comes to long-term wellness, oftentimes lifestyle changes can really play a big role in this. What are some changes that you would suggest that could be relatively easy for most of us at home?
Yeah, so small steps make big differences. So I tell my patients to aim for regular physical exercise. The recommendation is 150 minutes of moderate exercise per week. But I say you can break it down 10 minutes at a time, multiple sessions per day or per week. Make it comfortable, make it convenient for you. That is one. Two, healthy eating. Fruits, vegetables, whole grains, lean protein, all those are very good for you. Avoid smoking. Excessive alcohol is not good for you. Reduce stress. So stress through walking. I mean, you can reduce your stress through walking in the neighborhood, breathing exercise or mindfulness, spending time with your loved ones. Then, of
So some
course, this
easy things, not too bad, not too difficult for most of us to do. Dr.
make it
Jegede, I do really appreciate your time. Thank you so much for joining us today. We appreciate it. And if you'd like to watch this interview again, we're going to be posting it to our social media pages shortly.